As pre-election turmoil reverberates throughout the country, the NCPA remains at the forefront of public policy debate. NCPA Board Chairman Pete DuPont told Neil Cavuto on a recent Fox Business Channel pre-election special that voter discontent has boiled over in his home state, and that has major implications for those on Capitol Hill.
Pete DuPont, the former Republican governor from Delaware, he joins us right now. Pete, what do you think?
Christine is a very capable and good person at campaigning and working hard. But nobody thought that she could run against an incumbent congressman who'd been governor before that, who'd been a legislator before that. She'll have a real challenge.
The NCPA held standing room only Capitol Hill briefings on two of the issues that continue to dominate the election conversation: taxation and Obamacare. NCPA President John Goodman told Fox News in a post-briefing interview that this year's report from the public trustees of Social Security and Medicare is uncertain about the cost of Obamacare. So uncertain that the chief actuary felt compelled to issue a separate report.
The problem is that it's all a fantasy. It's based on assumptions that are so unrealistic that Medicare's own actuaries put out a separate report today, and I've never seen that happen before.
NCPA senior fellow Tom Saving, himself a former public trustee of Social Security and Medicare, told Capitol Hill staffers and media at the briefing that the problem is even worse than that.
Just pretending that something's going to happen isn't going to make it happen. And the problem with the 2010 trustees report is it's 100% fiction. They're pretending that all these things are going to happen. In healthcare, the customers don't care what it costs. And if they don't care what it costs, the providers aren't going to care either.
Former Comptroller General David Walker also appeared at the NCPA briefing. Walker said reforming Social Security is tough enough, but health care and tax reform are even more complex and time-consuming. The problem is we can no longer wait on those reforms.
We have to get serious about health care. We have to look at how can we realign our incentives, enhance transparency, ensure much more accountability for delivering results. Value for money.
The NCPA also held the first ever debate on the merits or demerits of Obamacare when John Goodman faced off against Ron Anderson, the CEO of Parkland Hospital in Dallas.
The NCPA, we do not think that you can manage complex social systems from the top down. If you have a group of people at the top and they have a plan, but everybody at the bottom has a self-interest in defeating that plan, then we don't think the plan's going to work. And in healthcare, if you have a group at the top and they have a plan to control costs, improve quality, and improve access, but at the bottom you have 300 million patients and 800,000 doctors, and every one of them has a self-interest in doing the exact opposite, then we think the plan isn't going to work. So bottom line is I think that all the goals are not going to be met. Costs are going to be higher, I think almost certainly. The quality of care may be lower for some of our sickest patients, and access to care may become more difficult for those who most need access to care.
A tempest is also brewing over a value-added tax to fund ever-increasing government budgets. NCPA senior fellow Larry Kotlikoff told an NCPA Capitol Hill briefing about the so-called VAT tax that what we cannot do is lose sight of the bigger picture.
The real problem here is that the spending is out of control. And we need to get control of that immediately, and we're going in the wrong direction.
And then there's the issue of jobs. Employment continues to suffer despite, or perhaps because of, congressional stimulus programs and the policies of the Federal Reserve. NCPA distinguished fellow Bob McTeer told CNBC that while job growth is sluggish, it would help the general economy a lot if banks would just put the money they have to work.
They've pumped reserves in the system, and the banks are holding those as excess reserves. They need to speed up money growth. Banks are hoarding excess reserves, and we need to pump more money into the system.
The key, McTeer said, is consumer demand, and corporate executives won't start adding jobs and payroll until consumers start spending again.
It's hard to get a lot of new investment if consumption isn't there. It's like a three-legged stool. Everything sort of depends on everything else. And consumption is the big enchilada here. It's 70% of the economy. And consumers still need to save, and they can no longer save by counting on the equity in their house and their portfolio. The only way they can save now is to cut back on consumption, and that's the thing that's going to haunt us for the next couple of years, I think.
NCPA senior policy analyst Pam Villarreal agreed. In an interview on PBS, she said the one thing we cannot do is eliminate the Bush tax cuts, because taxing the wealthy won't pay off deficits, but it will inhibit economic recovery.
If we expect our wealthy to be taxed to the point where they pay off these deficits and help pay down this debt, then we don't consider the dynamic effects of an economy when that happens. When you tax that percentage of the population, which pays most of the taxes, then they have to start cutting somewhere. So they start reducing their consumption.
The big news in the Gulf is no longer the BP oil spill, but the Obama administration's moratorium on drilling. NCPA senior fellow Sterling Burnett says the moratorium is a job killer for the already embattled Gulf Coast region and its residents.
We need to be drilling for oil. We need not to have a moratorium. We're already forcing people out of work in the Gulf, where the states are actively lobbying to get the moratorium taken off.
For more information about the NCPA, please contact us. You can call us or send us an email. We want to know what you think. And thanks for your support of the NCPA and the important work we're doing.